Good morning to everyone present here. I'm Dr. Kalpana from Department of Pediatric and Preventive Dentistry, SRM Dental College, Ramapuram. Today's session, we're going to talk about dental fear and anxiety among children. As we move on to the synopsis, here is the overall plan where we'll start with the emotions and cry and what are the different types of cry, fear, anxiety, phobia, how to assess them, and factors affecting the child's behavior in dental office, and how the maternal influence on the personality behavior of these children. As we move on to the introduction, what is behavior? Behavior simply means how a person acts or performs. Behavior dentistry, it is an interdisciplinary science that helps us understand and guide a child's behavior in the dental environment. And this basically emphasizes why behavior periodontics is very essential for creating a positive dental experience. As we move on to the emotions. First, what is emotion? Emotion is a state of mental excitement accompanied by physiological and behavior changes. As a child grows, their emotion response mature due to the development of the nervous and the endocrine system. Understanding these emotions is very important for predicting the behavior of the child in the dental environment. So basically, in the infancy stage, you will see different types of behavior like distress, startle response, and delight. When they reach into the early adulthood, you will see something called as anxiety, and in the late adulthood, this distress will go into grief. When you see the startle response in the infancy, will be shown as in early adulthood signs as fear, shame, anger, jealousy, joy, and disappointment. When you move into the late adulthood, it will be like worry, self pity, guilt, depression, and irritability. When you see a delight child in infancy and in early adulthood, they'll have elation and affection environment. When you go into the late adulthood, they'll have this possessive and satisfaction behavior. Then we'll move on to cry. So here, cry is one of the most direct and expressive emotions reaction in the children. According to Hellback in 1963, has classified cry into four different types of cry. The first one is an obstinate cry, where the children will have a loud, high-pitched cry, always have temper tantrums along with these cries. Next, in the frightened cry. Here, the child will have loads of fears and there will be a breath-catching sobs. Next is the hurt cry. This is a loud and more frequent cry accompanied by a small whimpers. This is resistant to the treatment. Next is the compensatory cry. This is basically not a cry at all. The child will be just making sounds so that we will not treat them or they doesn't want to get it treated. Recognizing these different types of cry will basically help us understand the emotion of the child and how we have to react for these different types of cry. Next, we move on to anger. What is anger? Anger is usually an outburst that results from a child's inability to manage a stressful situation. In a dental setting, that could be due to fear, inability to communicate, or the child will feel that they are not in the control of the environment, that someone is controlling their emotions or their behavior in the place. Next, we move on to fear. Fear is defined as an unpleasant emotion that arises due to real, unidentifiable threat. In children, dental fear is often triggered by sight, sound, smell, or previous dental experience. So again, for the each age group, this dental fear will be varying. And what are the fear of dental situations? First, fear in dental situation may originate from several factors, right? Traumatic experience in the past, innate fear which occurs even without stimuli. Objective fear can be by direct physical experiences. What is subjective fear? These are the fears which was caused or told by their parents or the peers. Like when you go there, I have experienced this, it was very painful. So it will be like that for you also. This is the subjective fear. And again, it is not the number of past visits by the emotional quality that matters. Fear also will lower the pain tolerance. So managing fear is very essential. And what are the fear evoking dental stimuli which can happen during the dental visit? And fear can be triggered by several factors, including fear of pain, betrayal, losing control, fear of unknown, fear of intrusion. Children respond to fear at three different levels. They can be of intellectual response, emotional response, and hedonic level. Next, we move on to anxiety. What is anxiety? Anxiety is similar to fear, but without a clear or immediate source of danger. It is a reaction of the unknown. Subtypes include association, attribution, and appraisal. Major causes include uncertainty, previous learning, and biological difference among the children. And what are the different types of anxiety? You have trait anxiety, state anxiety, free floating anxiety, situational anxiety, and general anxiety. These general anxiety is common in children where at a very early age they'll be anxious of various other situations, even from separating from their own parents, the child will feel anxious over there. Next, what are the different types of anxiety and the rating scales over there? There are several forms of anxiety rating scales like RMS pictorial scale, VAS, and 5-point anxiety rating scale. So before you start of the any kind of treatment, you can show these anxiety rating scale to the children. You can ask them to rate their own anxiety in front of the parents or with the help of the parents, so you can understand in what level the child is in and what is your role as a dentist can be played to reduce the anxiety level of the child, and at the same time you have to instill the positive dental behavior also. Next, we'll move on to phobia. Phobia, it is an irrational and intense fear that leads to avoidance of certain situation. It is out of proportion, cannot be reasoned with, and is beyond voluntary control. Phobias may be exogenous, triggered by environment, or it can be endogenous, which is originating within the child. We can assess phobia using the child's dental fear picture test. So again, here you will know whether there are various tests to assess the phobia, where Wong Baker's face pain scale rate and different rate where you can again child will be shown these images where the child can rate whether the child is phobia or scared of the situation or if the child is okay with the situation. Next, we'll include the factors affecting the child behavior in the dental office. Here, the behavior of the child is not influenced only by the child, it is influenced by the child, parent, and the dental surgeon. There are various factors like child, parent, and also by the dental surgeon. So, as per the child, their growth and development, IQ, past dental experience, and how, what is the position of the child in the family, and how can they adapt good to the social and the adaptive environment. And when it comes to the parents, their family influence, the parent-child relationship, the maternal anxiety, and the attitude of the parent to the dentist is also very important. And when you come after the dental surgeons, how the dental surgeon appearance is also very important. Why? Because most of the children have the fear for the white coat. And personality of the dentist. Is the dentist very scary or use a high-pitched voice at the first dental visit? Most of the kids might be scared of them. And the time and the length of the appointment, the skill, speed, use of fear promoting words, and most of the kids will like when the dentist appreciate the kid like being good or patting on the back, etc. And what are the factors which comes under the control of the dentist? So the clinic environment, some can be a good behavior, some can trigger into a bad behavior. What are the good behaviors are the clinic environment, dentist voice, body language and the communication style, and the pain control measures, time spent onto the dental clinic. What is the bad? It's like you load an LA in front of a child and you try to use any kind of instrument without informing. You're going to startle the child. The child gonna experience some of the bad behavior. Next is under the control of the child. What are the good behavior is when the child is growing environment, child try to adapt and the child is showing less of temperament. And previous dental visit is also very important over there. And where it will be bad was the peer pressure. When friends talking to the other friend by telling this dentist did this to me, and parents talking in front of the child by telling I underwent this procedure, it was very painful. The child, the dentist is going to give an LA to the child, and which will be going to be painful. Next is what are the factors comes under the control of the parent. Parent plays a very important role because when the child see any kind of anxious behavior in the parent, it's going to react pretty bad in that feeling over there. And the good environment of not much of overprotective parents and again underprotective or unrecognized behavior from the parent also have a different behavior child in the dental visit. So these are the different types of mother's behavior will influence the child's behavior. If the mother is going to be an overprotective and dominant mother, the child is usually will be anxious, shy, and submissive. If there's going to be over-indulgent mother, the baby is going to be aggressive, demanding, and display of different types of temper tantrum. If the mother is going to be an under affectionate mother, the child is actually well behaved. Sometimes the child will be shy, but will be able to cooperate to the treatment. If the parents are a rejecting type of parent, the children will be aggressive, overactive, evasive, and disobedient. Thank you so much.